Hello everyone, we are live again on a Saturday and we are going live today with Dr. Saloni, who is a cosmetologist and a dermatologist with over 8 years of experience and is based out in Bombay with Dr. Rekha Sheth's Skin Clinic. Hello everyone, hello. Hi Prateek. Hi Kavanya, hi everybody. And here she is joining us.
Hi, Tanya.
Hi doctor, how are you?
I'm good. How are you? Can you hear me?
Yes, I can hear you.
Because your sound is a little, I'm not able to hear you clearly.
Oh, can you hear me now? Am I sounding better?
I can hear you, but somehow the volume is a little low. I don't know. Anyway, can you hear me clearly?
I can hear you, yes.
Okay, all right. So tell me, how have you been?
I am good. How are you? And how's
I'm good too.
there in Bombay?
Bombay is good. Well, going on.
Nice. Um, it's usually pleasant in Bombay.
I really can't hear you, Tanya. I don't know. There's something is wrong. Can I rejoin?
Yeah, sure. You can rejoin.
Yeah, I'll just rejoin. Yeah.
Sure. Okay. There was a little voice concern, so I think Dr. Saloni will be sending us a request and we'll be joining with her soon. Just kind of sorting a little bit of network issue. Let me just check. 1 second. Hello. Hi, Tushar. Hi. You should be fine. Yes.
Hi. Yeah, this is better. It's better than before.
Uh, Glad. Thank God.
Yeah. Yeah, I know sometimes Instagram just acts a little weird. So,
I know.
anyway.
Definitely. So, Dr. Saloni, why don't you kind of let's start with you talking about yourself and kind of let's understand a little about yourself and your profession in general.
Okay, so basically, I am a dermatologist and a cosmetologist, and I have been working in Mumbai. I born and brought up in Mumbai, of course, and I have an experience of almost 8 years now,
Mm-hmm.
and I love what I do. Everything related to skin and hair, and I also like talking about skin and hair a lot. I like putting up educational posts and educational reels because I'm sure you know that the knowledge about skin and hair is it's almost like lacking out there, and there are so many, Instagram pages, so many people talking about skin and hair, but so many misconceptions are there,
Mm-hmm.
and that's why, as a dermatologist, I feel that if we doctors ourselves talk about this topic, I think it'll be a better guidance to, the people out there. So
Yeah,
yeah, that's what I do.
because as you rightly said, there are many good brands coming. Like we have here a clean beauty platform, and we try to educate as much as possible in terms of kind of giving the right information there, trying to help people as much as possible in terms of the different skin concerns, the different hair concerns, and telling them what to use, what not to use, as much as possible. So
Absolutely.
absolutely. I think it's a very good decision that as a dermat and a cosmetologist you feel, because if it's coming from a doctor's mouth, people are more likely to kind of say, okay, fine, this is verified. This
Yes,
is true.
yes.
So
Agreed.
yeah, so
Agreed.
yeah. So because it's summer, and I think many brands are many people are having this summer acne concern. Everybody's kind of having different kinds of acne, their back acne, their face acne. So let's talk about the common concerns regarding acne that you are facing these days. I mean, you must be having A lot of people.
Yes, yes, absolutely. So see, acne overall can happen in any season. However, as soon as summer starts, especially in a place like Mumbai where the weather can get extremely hot and humid and people sweat a lot. So around summers, the number of patients coming to us with acne, of course, other concerns as well, kind of increases a bit. So generally in other seasons as well, we get acne, but which are usually hormone related. In summers, we also get acne due to the clogging of sweat, clogging of pores because of excessive oil production, and also their scalps are sweaty, their scalps are greasy, because of which there are fungal elements that develop on the scalp. They form colonies which lead to flaking of the scalp, commonly known as dandruff. And this fungal colony as well can give you bumps on the face. Plus,
Yeah.
you're already sweating a lot on your body. So we get a lot of body acne as well in this weather.
Hmm.
So yeah, these are a few things which are commoner in summer, and usually on the in the other seasons we get more of hormonal acne.
So, if like, can you kind of uh, let's talk a little bit about the different types of acne in terms of like which acne can be surface based, they can be cured easily, and some which are in depth based, which need a little longer treatment, sort of. And
Right. Hmm. So, see, basically, there are four stages of acne. Acne starts with the formation of blackheads and whiteheads, something that we medically call as comedones. What happens over here is that, excess oil production or any dirt, dust, dead cells, these things can clog the pores. And because of pore clogging, there can be some inflammation, which leads to blackheads and whiteheads. Now,
Mhm.
on further inflammation, these blackheads and whiteheads go to stage two, which is the red bumps that we see on the face, right? So
Yeah.
those are called as stage two acne or papular acne. After this, if the microorganisms that are present in and around the skin, as residents, if these microorganisms also cause more inflammation, these papules or the red bumps can turn into pus-filled acne, commonly known as pustules, right? So generally, blackheads, whiteheads, these red bumps, that is papules or pustules, can be treated with on surface treatments or cream applications, right? If you are having just a few acne here and there, they can be treated with just some or the other cream application and general skin care.
Mhm.
However, if these acne are very recurrent and large in number, like they keep coming on and off, they keep increasing in number, then it is very important to not just treat them topically, but also treat them with proper medical advice, because the like recurrent acne could mean that there is some underlying problem that is there, maybe hormonal, maybe related to something else. So in these cases, a doctor's need is a must. Doctor's help is a must. There is a fourth stage of acne, which we called as nodular cystic acne, where deeper acne forms, which are like lumps. We call them nodules or cysts. These are not at all easy to treat, and only topicals don't help. So here we need a lot of guidance. We need to check. We need to evaluate hormonal changes. We need to check the person's lifestyle and a lot of other things. You may one may also need external treatments, any in clinic procedures. So these are the four main stages of acne.
That's very helpful. So, if somebody suffering with a particular sort of acne, probably it'll help them because there are many over the counter medications,
Correct.
over the
Hmm.
cosmetics available. So many times people have concerns whether should they buy that, or should we go to a dermat. So probably this will help. And if somebody has concern, they can directly reach out to you. So it'll be beneficial. Yeah.
Definitely. Definitely. I'll be happy to help.
Yeah, absolutely. We will have a lot of questions by the time we end we end a session. I think we'll be bombarded with questions. So yeah, I mean, when we say acne, like we've heard pure tea tree oil. If you apply this on any part of your body that has acne, is that beneficial? Is it true?
See, so tea tree oil basically is an anti-inflammatory. It reduces the inflammation and it somewhat, unclogs your pores. So if you are having, say, a couple of acne, just a few acne or a few blackheads or whiteheads, tea tree application may help in reducing it. However, again, like I said, if there are too many acne, then only tea tree oil may not help. In fact, those with very dry skin. Now again, it's a common misconception that acne usually occurs only on oily skin. In fact, most of my patients with acne have very dry, dehydrated skin. So if somebody has a dry, dehydrated, sensitive skin, tea tree oil can further increase the dryness, which leads the oil glands, it gives a signal to the oil glands to produce more oil. So more pore clogging and more acne. So there are both pros and cons of tea tree. It may work for a few acne, but not for more.
Okay, so basically it depends on skin type, whether oily
Yeah,
skin.
not just skin type, but the number of acne or what is the actual cause of the acne. And also, to be honest, not just tea tree oil, but anything. Well, studies of so many years have proven that acne cannot be treated with a single cream, like solo approach. Acne needs a holistic approach, meaning your lifestyle has to be perfect, your skin care has to be perfect, how what you're eating, what is the cause of your acne. You need to look at a lot of things, your habits. So one thing cannot treat acne. A
Now I'm
combination is required.
I'm coming back to your question. When you started
Yes.
talking about the misconceptions, I would like us to know more about these common misconceptions that people have about acne, because there must be many. So
Yeah,
tell me
yeah, there are.
which
Yes.
are common, and let's kind of help people. Like, this is not gonna help you guys.
Correct. Correct. Yeah. So, like some myths, that very common myths that I often get from my patients, one is, of course, like I said, acne does not only occur in oily skin. Acne also can happen if you have a dry skin. Another common misconception is home remedies for acne. I get so many questions about this. I have so many patients, garlic, lemon, baking soda, and what not on their acne. And in the end, it just burns your skin. So, no, please don't apply anything that you eat, anything that's available at home on your acne, because it is simply going to burn your skin. And the mark that it will leave behind is going to be even more difficult to treat. So, home remedies are a big no for acne. Another common misconception is that I can just directly take any anti-acne cream and apply it on the spot, on the area where I get acne. Well, to be honest, the fact that suppose somebody is getting acne on this particular area, the fact that you are having acne means that there is some underlying inflammation in the entire area. So the person applying the cream only on a particular spot is not going to help. It may help temporarily, but tomorrow you will find
Yeah,
another acne in other area, right? So I always advise application of creams in the entire area and not just in that particular spot.
very good point. Thank you. Yes, absolutely.
Yeah. And one last very common thing is not using a moisturizer and sunscreen when you have acne and you are undergoing anti-acne treatment. Because see, these anti-acne products, they are already very harsh and irritating to the skin. They can make the skin dry, right? Like I said, dry skin will make your acne worse. So it is very, very important to use a moisturizer along with your anti-acne products. And another thing, no matter what product you're using, even if you're using the best cream or taking the best treatment, unless you are protecting your skin with a sunscreen, nothing is gonna work. So these are a few things which are so simple but very commonly not taken seriously.
Yeah, that is true. That's true. See, like, because these are the many people go on Google. The
Correct.
first always go, kuch bhi hota hai, anything that happens, we'll go to Google, we'll type anti acne cream, anti acne
Yeah.
solution, by remedies. That's how we all are, because Google has made us so used to it. Now,
Yes.
any solutions that are available there, we think that's a good one. Or we'll go to an app and we directly go to a dermat.
Yes.
I mean, our lifestyle has become so, on the phone, on the technology, that we are kind of very, good, like,
Quick. And we want things quickly.
quickly. Absolutely. We want solutions quickly. We want it to
Yes.
heal quickly, to give it
Yes.
time.
And that does not happen. Yeah.
That is
Skin
it.
takes its own sweet time to heal, and most people don't have the patience to wait. But honestly, like whatever your issue is, even if you're trying to treat it, or even if you are just trying a new serum or a new product for your skin, anything takes at least 3-4 months to see visible results. So patience and consistency are two very important things.
Absolutely. Now, another thing that comes with acne is dark spots. And the and that's something, acne से ज्यादा उसे डर लगता है.
Absolutely, because they take more time and वो जल्दी जाते नहीं हैं.
Yeah, and people are more concerned कि acne तो चला जाएगा, dark spot नहीं जाएगा. So
Correct,
it's
correct.
it's stubborn. And so how do we kind of solve that problem? Because people say कि getting rid of dark spots is possible, but how far that's true, वो तो आप बता सकते हो.
Yeah. See, so सबसे पहले तो how to prevent these dark spots. Okay, उसके बाद मैं बताऊंगी if you already have what you can do. सबसे पहले, if you are getting 1 or 2 acne, don't touch your skin. Don't try to pop them. Human tendency, we are very tempted to pop our acne. Exactly. So don't touch your skin, don't pop your acne because that's going to leave a bad mark. Another thing, make sure whatever you do, you are protecting your skin with a good moisturizer and a good sunscreen, because in dono ke bina your skin is not going to repair, right? Even to treat the mark, the pigmentation, your skin needs to start its repair process. So without sun protection and moisturizer, skin is not going to repair. So ये बहुत जरूरी है. After that, if you're getting 1 or 2 acne, ठीक है, you applied some anti-acne cream, it went off. But if you're getting multiple acne again and again, please see a dermatologist as soon as possible. Don't wait for your acne to get worse and worse. Because the more you wait, the more the inflammation and the worse the pigmentation, the deeper the pigmentation. So treating your acne ASAP is very important to prevent deeper marks. See, marks also, if they're superficial, they can be treated easily. But most of these marks are quite deep, right? So, like we say, prevention is better than cure. So try to prevent this by treating your acne ASAP. Now, if suppose you do have a lot of acne and there are marks afterwards, what to do? See, there are two kind of spots. One, like you said, dark brown and black spots. Another, red spots. Very common again. Red spots are also very common. So, what to do in these cases? If you feel that your spots are not very deep or not too many, you can try to treat them. सबसे पहले moisturizer, sunscreen, of course, repeat your sunscreen every 3 hours generously, like and you can use vitamin C for I'm talking about the dark brown or black spots. You can use products like vitamin C, kojic acid, 3 to 6% glycolic acid helps, lactic acid, arbutin. These things help. Niacinamide helps. However, if you have red spots, then you can use vitamin C, azelaic acid, retinoids. These are a few things that help in treating the red spots. But like I said, most of these are quite stubborn and deep. So if you want to try treating them by yourself, you can try using these products. Use these for about say 2 months or so. If you feel that thoda bahut bhi result aa raha hai, to okay. But if you feel that no, it's not working, then you may need in clinic treatments. Your doctor may prescribe some creams which are only prescription based. Without a doctor's guidance, it's not very safe to use them. So you may be given some prescription based creams to apply. There are beautiful in-clinic treatments which are very safe and very effective, like microdermabrasion in combination with chemical peels. There are certain lasers, Q-switch laser. These treatments work very well in healing of these marks. So you can definitely opt for them without being scared of any side effects.
Like this is something that you tapped upon, because even, I mean, like a layman, people like somebody who's not too much into all this, I too didn't know there were two acne, like dark spots and red spots, like you are saying.
Hmm.
So
Hmm.
it's just, we kind of go for products and we don't even read the ingredients, like you said, niacinamide, uh, kojic acid. So
Right.
like the way you distinguish between these ingredients are for this type of acne, these are for, so अगर हमने उल्टा किया, will it harm our skin? Like
No,
अगर मैं,
no, no, no. No, if you're using it the right way, it will not harm your skin. Like for example, see, retinoids are a little irritating to the skin. However, if you're using it carefully, using it with a moisturizer, sunscreen, starting it slow, just thrice a week initially, properly use करते हो आप rule wise, तो कोई problem नहीं होगा. It's not going to harm your skin.
okay,
However,
that's
yeah, there are some people, like you said, we lack patience, right? So there are some people who एक साथ इतने सारे क्रीम्स लगा देते हैं. They want to apply everything together. They want to use 3 4 actives together, thinking that मैं सब ingredients use करूंगी या करूंगा तो my marks, my acne will go away faster. But no, that can be harmful. So at a time you can just use 1 or 2 actives. More than that can irritate your skin, can damage your skin barrier. So you need to balance it out, and that's why I generally don't prefer anybody treating their acne or marks at home. However, not everybody wants to directly approach a dermatologist. So
yeah,
if you are somebody who wants to try, then try it this way.
yeah. And anything, like telling them that at least give your skin this much time to kind of
Yes,
work.
to see any result. Yes, yes. Like I said, anything starts.
Yes, I'm there. Yeah, we
Call. That's
actually,
why I think it got. No, I was getting a call. That's why. Okay. So, see, like I said, for you to start seeing visible results, some visible results, it may take at least 8 to 12 weeks. And for a proper result, you need to have patience of at least 3 4 months. I mean, you cannot expect a miracle in 10 15 20 days. That's unfortunately not the case with skin and hair.
and we need to continue sticking to that particular product, or we can use multiple in that period of time.
You can use, like I said, 2 or 3 actives you can use at a time. But I generally suggest not using too strong actives on the same day. So I usually ask my patients to alternate their actives. Like, ek din ye use kiya, to next day ye. Something like that. Again, it depends on what combinations are being used.
And now, like you said, it's not just what you are applying on your skin, it's also about what are we eating in our daily lives. So what is
Correct.
our lifestyle life, like
Hmm.
how much
Hmm.
exposure, and are we applying the regularly applying our sunscreen, our moisturizer? Would you like to suggest how to layer this together, like first apply a moisturizer, then apply this, then apply that?
Yeah, see, so basics, the basics of layering, let's talk about that. So, for example, in EM routine, first rule, cleanse your face. Okay. No matter what, wash your face with a gentle face wash. That's a good idea to unclog your pores and prevent more clogging. After that, if there is a serum, for example, I always prefer applying vitamin C serum in morning, because vitamin C is a great sun protector along with a sunscreen. Also, a great antioxidant, helps in acne, pigmentation, skin brightening, everything. So, cleanse your face, apply your vitamin C serum, then moisturize, and then use your sunscreen. Sunscreen has to be applied in a generous amount. 2 finger full is usually the quantity for the entire face and neck, right? Repeat your sunscreen every 3 hours. At night, again, wash your face. If you're somebody who has applied makeup on top of their sunscreen, double cleanse. Remove makeup first, then clean your face. Otherwise, if the makeup is not removed, that itself can clog your pores and give more acne. So double cleanse if there is makeup, or else single cleanse. Then you can use certain serums that you're trying to use for your acne or your marks. You can apply the serums, on top of which apply a good layer of moisturizer. So this is how you layer your products.
Okay, now now basically makeup. Now let's talk about makeup. So people who are prone to, like, they love applying makeups, and how makeups can also affect our acne, and how can they kind of
Yeah,
acne. So what sort of makeup should we choose for acne prone skin? Ingredients that we should keep in mind to avoid?
right. Right. So basically, it's not about ingredients when it comes to makeup for acne prone skin. It's about the formulation. Like for acne, basically, if you're using a very greasy product, very greasy makeup, or oil based or thick cream based foundations, then that can definitely clog your pores. So, one, make sure that you're using any product that is oil free. It should be water based. It can be powdery, but I would refrain from using those greasy blushes, greasy eyeshadows, and very, very thick cream based mousses and foundations. So, those are a big no if you have an acne prone skin. That can just worsen your acne. Another thing is it's very important to wash your makeup applicators at least twice a week. If you are a regular makeup user, wash your makeup applicators at least thrice a week, because these, they retain the makeup on it. And while reusing the same applicator, you are clogging your pores. So washing and keeping them clean, very important. Another thing, don't share your makeup with anybody else. Sharing, again, can give you acne. These are a few things. And most importantly, remove your makeup before you sleep. So the formulation matters when it comes to makeup for acne.
That is true. So, I mean, these are very common things we should kind of do, like, in our day to day life.
Correct.
Hair makeup, clean your towels,
Yes.
it's like these are the saviors. Now, coming to this, I want to know, I mean, the viewers also want to know, what are your summer skincare ingredients that kind of you go to? They are saviors for you for acne, and how do you
In
kind of,
general. In
just
general, yeah.
in general, like,
Yeah.
how do you take care of your acne, and how do you kind of, what are your
Right.
go-to?
So yes. So first and foremost, my three most favorites, for summer especially, of course, for every season, but for summer especially, vitamin C. I love vitamin C on my skin. However, disclaimer over here, if you have a lot of active acne, excessively dry skin, excessively rosacea prone skin, don't jump to vitamin C. Treat all that first and then use vitamin C. So I love vitamin C. I love my moisturizer. So my moisturizers are generally a little lighter because I am slightly acne prone. So using heavy cream based products does clog my pores. So I generally use lighter gel or serum based moisturizers containing hyaluronic acid or ceramides. I love ceramides because they repair skin barrier very well. So, and the third is sunscreen. Like there is a sunscreen in all my bags. I don't leave my house without a sunscreen. Wherever I am, that one thing is always there. So these three most important. Other than that, I personally love using niacinamide and my retinoid at night because that keeps my skin sane, considering all the stress and the pollution that we undergo every day. So these are some of my favorites. However, there are other ingredients also which an acne prone skin can do with. One is, once a week or twice weekly exfoliation with salicylic acid. That's a great idea. 2% salicylic acid with or without glycolic acid. These two products are really good in exfoliating your skin. Do not use scrubs and heavy toners. They can again worsen your acne. So this is my tip for summer and acne.
I think gonna take some from you. That's really, really helpful. Thank you so much. And I think there are so many questions that we are bombarded with. We can,
Yeah, let's
kind of,
take some.
yeah. How to remove skin sun tanning?
Okay,
That's
so again, very common question in summer, but are we like, should I answer this? Are we taking this question or are we just taking acne?
we can. I think I would suggest you can directly reach out to Dr. Saloni in this regard. Some
Yeah.
are saying how to reduce or get rid of old acne spots.
Old acne spots.
Hmm.
Okay, so first and foremost, make sure you are using a good moisturizer and sunscreen like we spoke about before. You can try using 3 to 6% glycolic acid and you can also use maybe niacinamide. Try these two products, use them on alternate nights and do this for about a month. If you see that your spots are kind of starting to fade, then okay, continue, or else you see a dermatologist because generally old scars are the deepest.
Hmm.
So
I think
try
that's,
this.
yeah. There's another question from Charming Desert Rose. Sorry, how to get
Um,
clean skin as I have lots of
how to get clean skin as I have lots of
texture. I
texture. Okay, so I think by texture she means tiny, tiny bumps on her skin or maybe scars. So see, if you have tiny bumps on your skin, the bumps could be acne. The bump could be something called as dermatitis. Could be sensitive, dry skin. So it is better that first you get yourself evaluated, know what it is, and treat it accordingly. But in general, I would suggest you can probably use 2% salicylic acid with glycolic acid. Use this as an exfoliator about once or twice a week. Like cleanse your face, apply the exfoliator on your face, rinse after 5 minutes, apply your moisturizer and sunscreen. You can also try using retinol thrice a week. This will help in getting rid of the bumps on your skin and give you a smoother texture. However, if you are talking about the pits, that is the post-acne scars, then those cannot be treated with any creams. You'll need lasers for the same.
thank you. And we have Shaimani. She's asking, will fillers fill acne scars?
Well, yes, we do. We do fillers as well for acne scars. There are different grades of fillers. So for acne scars, we use a lighter hyaluronic acid product. However, it depends on what kind of scar you have. Fillers cannot fill all types of scars, so you'll have to probably get yourself evaluated. Again, fillers last only for about a year or so on your acne scar. So better treatment would be something called as microneedling with radiofrequency. You may have to do this treatment like say once a month or once in 6 weeks for about 4 to 8 sessions, depending on the depth of your scars. This will make your skin produce natural collagen, and this collagen is going to fill up your scar in a beautiful way. So why not go for MNRF? So again, as I said, it depends on what kind of scars you have.
Absolutely, absolutely. We have Charming Desert Rose asking, what is the right time to treat acne, when it is new or when it is red?
When it is new, when I mean ASAP, like I said before, like I mentioned before, the right time to treat it is as soon as you start seeing some acne.
Is using milk and curd on skin good for acne?
It's not going to do much for your acne. So milk is nothing but lactic acid. That is an exfoliator. So I mean, the common story that Cleopatra used to bathe herself in milk, and that's why she was beautiful. So yes, milk has lactic acid. So uh, may help in exfoliation, but won't do much for your acne.
Which sunscreen to use for oily, acne prone, sensitive skin?
Okay. So again, like I said, the game is about formulation and not the product. See, so if you have an acne prone oily skin, then better to use sunscreens which are lighter, that is gel based or water based. These days there are beautiful gel based, water based sunscreens available. See, now honestly, being ethical, I wouldn't want to, name out any product specifically because we are not here to promote. But if you want recommendations for your kind of skin, then on my page there is a highlight. There are two highlights named product 1 and product 2. You can go over there. I have recommended some products depending on the skin type. You can choose yours. However, I cannot give you a specific name unless I personally check your skin.
Absolutely. We have Pratik Rohel, how to get rid of dark circles for men. Please, you can ask the doctor directly. That's something not.
Yes, you can ask. You can DM me, or there are multiple reels on dark circle on my feed. You can check those out. I'm sure it will help you.
Yes. We have Ashi. Does an active cream stop working on skin because of applying it every day?
Not really. Not really. So no active stops working. However, it depends. Maybe it is not the right active for your skin, or you're not using it the right way. Either of the two.
I think we have answered most of our questions. Anything that's regarding dark circles, dark skin,
Anything other than acne.
think what are the different types of acne?
I think we've already answered that. There are blackheads,
Yeah.
whiteheads, there are red bumps, there are pus-filled acne, there are cysts and nodules.
And how to cure back acne, we have also, I think, answered that. So uh, can you
I
please
think I can take that one. We've not answered back acne. I can quickly take that one because again, like a very common issue in summers. See, so back acne basically first and foremost, get to know the reason, multiple reasons. One very common reason is excessive sweating on the back, from for example, if after working out or after being out and sweaty, you're not bathing yourself immediately, then the sweat and the microorganisms can just clog your pores, giving you acne. The tight fitting clothes that you wear, the friction can give you acne. Hair oil can also trickle down your back and give you acne on the back, chest, shoulder, arms. So be very careful when you're oiling your hair. Dandruff can give you back acne. Make sure if you have dandruff, you are treating it very well. Your shampoos, your conditioners mainly. A lot of times, those with long hair, we apply conditioners and then that sticks to the back. That can clog the pores. Very common cause of back acne. Another common cause, whey protein. So if you are somebody who's acne prone, instead of whey protein, see, protein supplements, protein powders are good. But instead of whey protein, you can choose pea protein or plant protein. Many brands available these days. So these are a few, of course, hormonal issues. Again, very common cause. So get to know the cause, treat it accordingly. If it is habit related, correct your habit, bathes immediately after sweating. You can try using salicylic acid, benzoyl peroxide. There are sprays available these days. You can use like 5% benzoyl peroxide washes. Like thrice a week, 10 minutes before bath. Just apply the wash. And if your back acne still persists, please see a dermatologist.
Can we self-treat using clindamycin and benazole?
So clindamycin and benzoyl peroxide, yes, but it really honest. Could you hear me? I can't hear you. I can't hear you.
I am there, I'm there. We lost each other, but I'm still there. Can you hear me? Can you hear me?
Yes, I can hear you. Can you hear me? Can you hear me?
Yes, I can hear you.
Yeah. So, like
Absolutely.
I was saying, clindamycin is kind of resistant on a lot of skin, so may or may not work. So I can't really tell you. Again, it depends on what acne you have.
And lastly, we'll answer how to treat acne from waxing our face.
Okay, so the so-called acne or bumps that you notice after waxing may not really be acne. it could be folliculitis. Of course, vaccine can trigger some acne, but most of those are called folliculitis, meaning the because vaccine kind of irritates your skin. You know, it's like you're just pulling it off your skin, you're pulling the wax off your skin. The area around the hair follicles gets irritated and inflamed, which leads to bumps, and those bumps are known as folliculitis and not acne. Some acne may get aggravated, but not immediately. Those appear later. So the immediate ones are folliculitis. So one simple solution: don't wax your face. So instead of waxing, you can opt for shaving, or you can opt for epilating, or the best thing is laser hair reduction. But if you do get folliculitis, don't wax, because these folliculitis bumps can leave a lot of marks. And there is no way you can treat those by yourself. Seek help from a dermatologist.
That was wonderful. Thank you so much, Dr. Saloni. Thank you very much. And thank you
Glad.
for being a part of the life. And I'm sure it has been fruitful for everyone. Thank you. It was
Thank you for
wonderful.
inviting me. And I think I enjoyed the session as well. And I hope our audience today got to learn something about acne.
Absolutely. Absolutely. And please DM her if you have any further questions and queries. And I'm sure it'll be helpful.
Always, anytime. All right. So nice talking to you, Tanya. And I hope everybody has a great evening and a great weekend.
You too. Have a wonderful Sunday and a
Thank
nice
you. Bye.
thank, thank you everyone. Thank you. It was wonderful.